Our study is really about answering a very important and fundamental question, and that is how many people in the state of Washington have actually been infected with COVID-19? Every day at UW Medicine, we do thousands of tests for COVID-19, and other laboratories around the state do as well. But of course, to get a test, people need to have some reason they want that. Maybe they have symptoms. Maybe they have had contact with someone who they think has the virus. But that tells us how many people have gotten through that passageway to the testing for the virus itself. What we'd like to know is how many people have just had it. Since this all got started sometime in January or so, how many people have been infected? And the way we'll do that is by looking not for the virus itself, but actually for the body's reaction to the virus. And we'll look for the antibodies that the virus makes as the body fights off COVID-19. But the presence of those antibodies will tell us how many people have actually had the infection. We've been doing these antibody tests for a couple months at UW Medicine. We know the antibody test is extremely reliable. We know it works extremely well. In this study, we'll actually look at 7,000 participants all across the state of Washington, from eastern Washington, from west of the mountains, from rural areas and urban areas, people in various racial and ethnic groups, and really try to get a sense of where's the virus been in these first months of the pandemic, so that we can really understand what populations have been most at risk and what kind of interventions might be most useful in trying to control this. We'll not only get a look at what's happening right now during the summer, but we'll follow that up by following the patients and the participants in the study into the winter. We'll get a follow-up test in the winter and then a third round of testing in the springtime. And the idea is that we'll get a sense about not only what does the pandemic look like right now, but how is it changing over time. The final thing we'd really hope to learn from this is what does it really mean to have these antibodies? We know the antibodies tell in a very reliable way whether you've had the infection, but one thing we all hope is that the antibodies also mean that you have at least some protection from the virus and from future infections. And we're optimistic that this study may help provide data that tells us whether that's true. And if so, that'll be very encouraging for the vaccine trials that we've all heard so much about and that we're all so optimistic for. So again, we're thrilled to work with the foundation. We're thrilled to work with the Department of Health. We're very excited to get this study going, and we think it's going to be incredibly informative and exciting to do. So thank you very much.